You can start.
Okay, so our community organization project is on Bemidji, Minnesota. The purpose of this presentation is that we aim to fight against and prevent substance abuse within the city of Bemidji, Minnesota. The report that we use is an assessment of the health and wellness of Bemidji citizens. It assesses the level of substance abuse and addiction currently in action in the community of Bemidji. And identifies the areas in which there needs to be change. The purpose of the needs assessment report is to provide a foundation for revising the current habits and programs related to substance abuse in Bemidji. And community health needs assessment is critical to a community benefit program. And our goals are to build on and enhance community assets, promote collaboration, improve community health, and promote innovation and research. So recognizing the issue, Minnesota experienced 713 opioid-related deaths from 2000 to 2007. From 2008 to 2015, that more than doubled to 1,560. High rates of opioid, heroin, and methamphetamine use are present. 36 overdoses occurred from April to June. 8 were fatal. 8 overdose deaths in the second quarter of 2020. And victims range in age from 21 to 66. A survey conducted by a new recovery program in Bemidji found that majority of respondents have had a loved one impacted by addiction. As Narcan becomes more widely available, overdoses are going to unreported more often. And Narcan is a medication to treat a narcotic overdose. Research at the University of Minnesota shows that women often have depression, anxiety, and other problems that coincide with opioid use. Beltrami County, which is the county, it's part of Bemidji, has the highest per capita number of children in foster care in the state, often due to neglect, abuse, and substance use. Neonatal abstinence syndrome is one of the most noticeable. Beltrami County reached a peak in 2017 with 1,262 children in foster care. In 2018, around 6,700 children were placed into foster care in Minnesota. Bemidji Medical Center is seeing higher rates of newborns going through withdrawal symptoms. And this becomes a strain on the economy, and state aid is greatly needed and used. The history of Bemidji. Bemidji was named after an Ojibwe leader whose people lived in the south end of Lake Bemidji and around Lake Irving, including the state where white settlers founded this town. May 20, 1896, the village of Bemidji was incorporated. The community is on the shore of Lake Bemidji, one of more than 400 lakes in the region, and is known as the first city on the Mississippi. Sanford Bemidji Medical Center has been a vital part of the community since 1898, and Bemidji serves as the center for economic development for all northern Minnesota and is the regional hub for educational service, healthcare, retail, shopping, transportation, finance, and government services.
Next, we'll talk about the demographics for Bemidji. So as of the census in 2010, the population was around 13,431. There were 5,339 households and 2,550. The median age in the city was 27 years. 19% of residents were under the age of 18. From 18 to 24 is about 26%, and 25 to 44 is about 21%. The range 45 to 64 is about 17%, and 14.8% were 65 and older. The population is split pretty evenly with 47% male and 52% female. So within Bemidji, the age that is most likely affected from drug abuse is between 20 and 35. It's split pretty evenly between genders. Um, the number of babies that have been born at Sanford Bemidji placed on protective holds due to a positive drug test has tripled since 2008. It's gone from 25 all the way up to 75. In 2015, there were 74 babies born with neonatal abstinence syndrome withdrawal symptoms caused by opioid exposure um, before they were born, and 60% were placed in foster care because most mothers weren't taking opioid medication therapy and were suspected of abusing other drugs. Narcan has increased in prevalence. As we talked about earlier, it's a medication to block the effects of opioids. It can be used in a nasal spray or injected. It was deployed 13 times in 2019, and in the first 7 months of 2020, it had already been deployed 25 times by the police, and it costs $70 per dose. There was a survey conducted by the New Recovery Program, and it found that a majority of residents have a loved one that is impacted by addiction, and that most believe alcohol and drug abuse is very common in the city. So next we'll talk about some community assets. There's one called Face It Together. It's a nonprofit. It has many locations across the country. It helps connect people with substance abuse disorders, coaches, and resources that are in their area. There was a community survey with 185 respondents. It showed that compared to Face It Together locations, community members are more concerned about Bemidji addiction in Bemidji. There was a concentrated effort at Sanford Bemidji to support addicted mothers before their deliveries had been made, and it made a big difference. Hospitals in Minnesota are hoping to expand on Bemidji's First Steps to Healthy Babies program to help combat the opioid epidemic. At Sanford Bemidji, the solution has gone beyond identification and treatment. Their medication-assisted therapy clinic prescribes buprenorphine to eliminate opioid cravings for women while they're pregnant. This helps reduce the chances of the newborns experiencing premature birth. The Bemidji Area Program for Recovery provides substance use disorder treatment to the area. Some more community assets are North Homes Children and Family Services. This is licensed by the Minnesota Department of Human Services. It's a resource for foster care. Children and their families benefit from foster homes that are willing to be supportive, mentoring, and caring. Providing these children with a nurturing home will provide children the least restrictive, most appropriate setting to address their needs. As we talked about earlier, there's the Bemidji Area Program for Recovery, and upon entering this recovery facility, the health experts will provide a chemical use assessment, and this helps to determine the type of treatment that they will need for recovery.
Next is needs for assessment. The study design and methodology is a generalizable survey will be conducted of all residents in the city of Bemidji. An online non-generalizable survey will be conducted by Sanford and Beltrami Public Health. Community stakeholders will be invited to review the findings from assessment research and to discuss the public health issue. Asset mapping will be conducted by reviewing the data and identifying the unmet needs from the surveys and data. Some methods include a health risk assessment survey of citizens, interviews with key informants, the collection of assessment of policies related to the health and wellness of citizens, and the city environment inspection. Continued the results of the assessment conducted by Stanford Health in 2015. Some of the key findings were based on the generalizable and non-generalizable survey data. Key indicators were ranked on a 1 through 5 likely scale, with 5 being the highest concern ranking. Survey results ranking 3.5 or higher, and high ranking concerns for both the generalizable survey and the key stakeholder non-generalizable survey. Underage drug use and abuse, 4.24. Drug use and abuse, 4.45. In an assessment conducted by Sanford Health Bemidji in 2016, child abuse and neglects. So 4.23 non-generalizable and 4.07 generalizable. Presence of street drug, prescription drugs, and alcohol in the community was 4.52 non-generalizable and 4.04 generalizable. So results continued. In an assessment conducted by Sanford Health Bemidji in 2016, the level of concern was statements about the community regarding substance use and abuse, underage drug use and abuse, 4.24 non-generalizable, 3.9 generalizable, drug use and abuse, 4.45 non-generalizable, 3.78 generalizable, non-generalizable prescription or non-prescription drug abuse. So the non-generalizable is 4.1% yes, 95.9% no, and generalizable 0.6% yes, 99.4% no. The needs of the community are a 24-hour recovery center for drug addiction and addiction committee, a family therapy assistance program and educational program. The committee should be responsible for communication between the two companies and community. They will recommend health and addiction activities and environmental changes in the community. The committee should have multiple members from each age group and include citizens from different levels within the community. And the citizens that oversees all implementation within the committee should be the one who is committed to ridding drug abuse from the community. So the program mission and goals. Mission of the program is to decrease the number of Bemidji citizens who are abusing drugs and through increasing citizen knowledge of the benefits of sobriety and health while improving their access to options for health and wellness promotional activities. For drug abuse, the goal is to reduce drug abuse and addiction and increase awareness of opioids, methamphetamine, etc. Objective: 60% of citizens with substance abuse problems will have quit abusing drugs by the end of the community organization plan. Goal: to reduce overdoses within the Bemidji area. And another objective is 80% of the new overdose cases will be reported by the end of the community organization plan.
All right, I'll be continuing foster care mission, our program mission and goals about foster care children with youth abandoned. Our goal is to release children back to their parents or guardian. Our objective will be 60% of children foster care will be reunited their parents or guardian by the end of the community organization plan. The goal, the other goal we have is to reduce the number of children in a foster care. Our objective will be the number of children admitted into the foster care due to the parental substance abuse. So the implementation, we have two priorities. The first priority will be substance abuse, which will be we're gonna use a power with the parent support. We're gonna use their coaching provided by highly trained peers who have worked client issues. We're gonna track, measure the client progress. The outcome shows that the coaching keeps the people well. So the priority 2 will be children and youth. Sanford Health Bemidji has one of the priority concern is to recover, help connect the children and their appropriate resource and programs, can get them referral count or therapy. Their children advocates concern provide children prevention and education program. Implementation continues. So we're gonna have the two drug addiction program used to Sanford Health and Face Nation will be implemented over the next 6 months. The program will be used together and reviewed 6 months and changed to meet the community needs. The program, the two program will sponsor health prevention service, the community that will benefit their families. The programs that have carefully implemented and previously evaluated will be continuously positive outcome. Successful drug-free community programs are ongoing and evolving. The implementation include electronic communication media, writing materials, charts, questions and answers, some suggestions, and suggestion box. The city program will survey their citizen and their family regarding the interest in the drug misuse and health wellness. When we come to the evaluating the program, generally we will be looking, our evaluation is going to be based on goals, objectives. If we reach our goals and objectives, we will start collecting and analyzing information of program activities. For example, the number of youth on drug abuse addicted compared to the when we start the program. We look also characteristics and outcome of program, so we can make judgment about the program results. When we gather all this information program, we can improve the effectiveness. This could be done by survey data collection throughout program and statistics. We will keep daily record the program that include which is being spent on activity, time, dollars, and number of positive drug tests, what activity are being taken place, and number of people attended. We will obtain the feedback on all activity, revised program to meet the specific and changing needs of the community. We will use evaluation measurement to identify follows the program, and we will use the measurement to identify the trend, both positive and negative, to uncover the best practice and improvement. And we have the last page, our references, and I believe our presentation is concluded. The end.